So I've already previously done my YPAs, but I'm just going to verbalize that I've already done it. This is my second section of the head to toe. I'm going to start by doing her upper range of motion. Can you stand up for me? Can you put your hands above your head? And then hyperextend them back. And then put your hands behind your head. And then I'm going to have you turn around and put your hands down. And then put your hands up towards your scapula. And then turn back around. And then put your hands out. And then go like this. And then like this. So our flexion and extension is intact. And then put your hands down. And then go up. And then down. And then can you go back up? And then go over your midline. So, and then do the other side. So this is abduction and then adduction. And then flip your hands, so supination and pronation. And then push down and then up on both sides. Let's see, and then do the fingers. And then, let's see, do your hand soles in and out. And then pull back on my hands. So her pull is intact, and then her push is intact and strength. And then grip my fingers. Her grip strength is equal bilaterally. I'm going to palpate for a crepitus now. And I'm just only going to do this on one side for the video. No crepitus is present in her shoulders. No crepitus present in her elbows. And none in her wrist. Her range of motion is intact, without limitations to her shoulders, elbows, wrists, or fingers. I see no muscle wasting anteriorly or posteriorly. I'm going to look at her fingernails. Her fingernails are pink, no clubbing, they're flat. And her cap refill is less than 30 seconds. I think that's all for the upper range of motion and stuff. Can you lay down on the bed for me? Okay, can you bring your legs straight up? And then down. And then bring your knee to your chest. And then back down. And then bring your leg out, and then across your midline. And then bring your knees up just in a sitting position, both sides. And then can you push against mine, and then pull. So that is intact, her push and pull is intact. And then can you open on both sides? And then I'm going to have you put your legs down, and put your feet up, and then down, and then turn your soles in and out. And then I'm going to have you push on my feet, and then push on my hands, and then pull on my hands. So that's intact. And then I'm just going to go ahead and check your cap refill. Your toenails are pink, and no clubbing, and they're flat. And your cap refill is less than 3 seconds. I'm going to just palpate for crepitus. No crepitus is present. And I would do that again bilaterally, but for the video's sake, I'm not. And no crepitus is noted. Her range of motion is intact for her hip, knees, ankles, and toes. No, without limitations. I see no muscle wasting present. I think that's all for your lower range of motion. Then I'm going to ask you to stand up. And I'm just going to look at your spine real quick. I'm going to have you dangle. Your cervical is concave, your thoracic is convex, and then your lumbar is concave. Her spine is straight and her vertebrae is straight. I see no scoliotic deviations. I'm going to have you set up for me. Your scapula is even to your shoulder blades, and your iliac crest and your gluteal folds are all symmetrical and even. Can you turn around towards the camera? I'm going to have you bend down and then lean back and then side to side. So there is some range, with this range of motion, there are some limitations, but is that normal for you?
Yeah.
Okay. And then I'm going to do, let's do the lungs. So I'm going to have you sit on the bed. Her AP to transverse is a 1 to 2, and her chest expansion is symmetrical. Her respirations are within normal limit, and they're even and symmetrical without any limitations. They're effortless. Now I'm just going to percuss her lungs real quick. So there was flat over the bone part and then resonance on the other parts. Now I'm going to have you turn around. I'm going to move your hair real quick. So I heard resonance throughout this area, and then I am going to have you turn back around real quick once you get that back up. So I'm just going to listen to your lung sounds as you breathe in and out for me, and I'm going to be using my diaphragm. I'm not going to actually listen for a full respiratory cycle, but in a real thing you would, but I'm just going to verbalize that I would do that. So all lungs were clear to auscultation. I heard nothing abnormal. And I'm going to have you turn around. So all lung fields were clear to auscultation. But I was listening for bronchiovesicular through, no, your bronchial through here, and then your bronchiovesicular right through here, and then your vesicular all through here, and then your bronchiovesicular through here, and then your vesicular right through here. We're gonna do the heart now, and my diaphragm to first listen to S1 and S2. And we're gonna go to her second intercostal space on the right side, on your right sternal border. S1, S2 present. And I'm gonna listen to her, that's your aortic, then on this side is your pulmonic on your second intercostal space, left sternal border. And then Erb's point is at your third intercostal space on your left sternal border. And then your tricuspid is on your fifth intercostal space, left sternal border. I'm just gonna. And then your mitral is on your fifth intercostal space, not intercostal space, on your midclavicular line. So S1 and S2 is all present. And then I would go ahead and turn it around to my bell and go ahead and listen to see if I hear any murmurs in her aortic, pulmonic, tricuspid, and mitral. In the Erb's point, I should just be able to hear S1 and S2. No murmurs were present, and I just heard the S1 and S2 on the Erb's point. I'm going to have you lie down on your left side. And I would palpate your PMI. And I would usually palpate that for about 60 seconds, but for the video I'm just going to say that I was. And I have 86 beats per minute. And then now I'm going to have you sit back up for me. And then as I listen to your mitral valve, I'm going to then just feel your radial pulse. So her mitral and radial pulse was equal rate and rhythm. Now we're going to do the breast exam. And I'm going to have her just put her hands above her head, and I would just inspect for indurations, bulging, or like any abnormalities, dimpling, bulging, and durations, and I see none present. And put your hands on your hips for me. No dimpling, bulging, or indurations is present there, and her boobs seem to be firm and consistent. And then I'm just going to do this part on myself. So I would palpate using 3 fingers and a circular motion and do light, medium, and deep pressure. And I would just start by the talus spence, and then I would go down vertically. Here. And then just go over an inch and then start back. And I'd be doing light, medium, and deep pressure this whole time until I hit the clavicle, and then go over an inch, and then I'd repeat this until I hit my sternum. And I would ask the patient if they feel any tenderness, and I would note if I felt any masses or rigidity. And we're going to say that I felt none and the patient felt no tenderness. And then I would use my finger and my thumb and compress her areola and nipple, and I would see if there was any discharge present, and we're going to say that there was none. Then her breasts seem to be symmetrical. There's no redness or vascularity issues, or I see no lesions or nodules or ulcers. And then I'm going to do the lymph nodes, and so this is the epitrochlear, and then your lateral, and then your central axillary, and then your subscapular is back here, and then your pectoral is right here. And I would do that on both sides, and they're non-palpable. I would do the breast exam on both sides, but for the video purposes, we're not going to do that. Now we're going to do the pulses. this is the radial pulse. It's 2+ bilaterally, and then the ulnar pulse is 2+ bilaterally, and then your brachial 2+ bilaterally, and then I'm gonna have you scoot to the edge. It is popliteals 2+ bilaterally, and then I'm going to do her dorsal pedialis. And let me see her other foot. It's 2+ bilaterally, and then your posterior tibials 2+ bilaterally. I'm gonna have you lay down, and then I'm going to do her femoral. This is a little awkward. I'm sorry. Her femoral is 2+ bilaterally. I'm gonna have you sit back up for me. Let's see, we're gonna do the abdomen. I'll go ahead and lay down. We're gonna do the abdomen next. As I'm just looking from her right side, I see that she has no striae or discolorations bulging. She has a slight pulsation. I see no nodules that are present or scars. She has a tattoo on her left side, but it appears to be healed. And then I'm just gonna use, I see no striae, discolorations, or bulging masses from this side either. I still see nothing. So there's no discolorations, masses, striae, bulging, there's a slight pulsation that's present. Do you have any pain in your abdomen anywhere? No. Okay, well I'm going to go ahead and listen to your bell sounds. Now I'd usually listen to this for a full minute, but I'm not going to do it for the video purposes. I'd start in the right lower quadrant, and then go to the right upper quadrant, and then left upper quadrant, and left lower quadrant. And her bowel sounds are present and intact. They're normal. And then I would percuss, going in the same motion. So tympani was heard over all the organs. And then I'm just going to palpate, and you said you have no pain anywhere, right? So I'm just going to do light touch. Tell me if you feel any tenderness. Do you feel any tenderness? No. So no tenderness is noted. I felt no masses or nodules. Let's see, what do we want to do? You guys sit back up. I'm going to verbalize the female and male genitalia, and we're going to start off with the female. So I just look at the distribution of the hair, and it's curly, coarse, and dark. I see no inhabitants or lice noted. And then I would just inspect the general skin, and there's no discolorations, nodules, masses, papules, or vesicles, or bruising noted. And then I would just inspect the general skin of the penis, and there's no swelling. It's pink, it's wrinkly, and it's hairless. And then I would palpate the penis, and I see no, I would just use my finger, and I would just palpate the glands, and there's no discharge or swelling. I felt no masses or nodules to it, or discoloration or bruising. And then I would, the uteral meatus is in the middle center of his penis, and then I would palpate the scrotum, and there's usually some slight tenderness, and so they would say if there's like more than usual, and I felt no nodules or masses present. No, the tenderness was slight. Then I would I would do the inguinal opening, and I would just follow it all the way behind the scrotum and between the groin folds. And I would see if there's any abnormal bulging or inguinal hernias. And then I would then have them stand up supine, and I would use my lubricated finger and I would stick it in their rectum, and I would push it towards their scrotum, and that should be able to fill their prostate, and it should be firm, heart-shaped, smooth, and it should be like slightly movable but not too much, and it shouldn't be too large or like hard. And then I would look at the anus and I would see if they have any hemorrhoids, and no hemorrhoids were noted. And then I would do the female genitalia now. And then, so the female genitalia, there's no, it's dark, curly, and coarse hair. There's no inhabitants or lice noted. And then I would just expect the labia majora, and there's no discolorations, bruising, masses, or nodules present. No swelling, and it should be pink and moist and smooth. It's the larger hood, and then the smaller hood is the labia minora, and it should be slightly darker and moist. It's symmetrical, and there should be no discolorations, bulging, no swelling. There should be no masses or nodules present. And then I would do the vulvar area, and it should be symmetrical, and there's no abnormal bulging or discolorations. And then her urethral meatus should be a slit down the midline. There's no discoloration or drainage or swelling. And then I would inspect her anus, and I see no hemorrhoids are present. And then now I'm going to do the sensory test. I'm going to ask her to close her eyes and then tell me if she, when she feels this.
No. 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 No.
Her sensory delight touch is intact. And then this is sharp, and then this is dull, and tell me which one you feel.
Dull. 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 Sharp. 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 Dull. Dull.
So her sensory to dull and sharp is intact. And then I'm going to have her to go like this on her lap. And then I'm going to have her to touch my finger. You touch your nose to my finger. Touch your finger to your nose to my finger, sorry.
Okay.
And then back. And then I'm going to have her to touch her finger to her thumbs and then back. And then I'm going to have you take your leg and run it down your shin, like this. And then I'm going to have you walk ankle to heel like this.
Is that good?
Yes. And so her cerebral function is intact. And then now I'm going to do your reflexes. I'm going to start by doing I would just do these bilaterally, but I'm just going to do one side for this video. So I'd find her biceps tendon, and then I'd hit my so that's intact. And then her triceps, I'm just going to have her relax on me. And then I'm going to do her brachial radialis. Can you flex your fingers for me? Okay. So her brachial radialis is intact, and so is her triceps and biceps. And then I'm gonna raise her bed a little bit so her fingers are dangling. I'm gonna do her patellar reflex.
I'm sorry.
Do you have hyperactive?
Yeah, I do.
Okay.
I'm sorry. Brain surgery. Go ahead.
Then I'm gonna do her Achilles. And then I'm gonna have you lay down back on the bed.
Okay. I don't like that. It's not cute.
So her plantar superficial is a negative, and her Achilles, her patellar, her brachioradialis, and her triceps and biceps are all 2+ bilaterally. They're normal. I think I'm done.